Hi everyone, greetings from your former program director and the Pitt faculty. First, I want to say thank you to all of our alumni for their past generosity. Over the years, you have really come through to fund our nurse anesthesia students so they can attend the AANA Annual Congress. In 2019 alone, we raised $26,318 during our annual Engage Pitt Nurse Anesthesia travel campaign. Through your support, we sent 26 students to the 2019 AANA Congress in Chicago. It was our hope to be able to fund students to attend the 2020 Annual Congress in San Diego. Unfortunately, due to the COVID-19 pandemic, we were unable to do so, and thus, I did not engage in a fundraising effort. We have high hopes that a vaccine is on the horizon and that our country is on track toward recovery. That being said, we do plan to launch our annual Engage Pitt campaign in May next year, raising funds for our students to attend the 2021 AANA Congress in Austin, Texas. When the time comes, I hope we can once again count on your support. Over the past year, we have continued our successes as a program. Despite the pandemic, we have continued to provide an excellent education to our students. As you know, the last master's cohort graduated in 2018, and we graduated our first doctoral cohort successfully in 2019. A total of 37 students graduated, and I'm happy to say all are employed in the nurse anesthesia workforce. In March, all of our students were removed from clinical, and we sat out a 3-month period. During that time, all of our 2020 students completed their scholarly projects, and the other 2 cohorts worked on theirs. I'm happy to report that despite sitting out for 3 months, our graduating students have on average more than 750 cases and more than 2,300 hours. For context, the ANA requirement is only 600 cases and 2,000 hours. I'm also proud of this graduating class for their work on preparing for the National Certification Examination. They've worked hard to prepare, and all of them took the SEE exam with an average score of 464. This is the 88th national percentile rank for third-year students across the U.S. Quite an accomplishment. We continue to be ranked by U.S. News & World Report as one of the top U.S. nurse anesthesia programs since 1998. Our last ranking was number 4, and we should know our new ranking in time for the 2021 meeting. 10 University of Pittsburgh students were awarded AANA Foundation National Scholarships. To put this in context, there were only 71 scholarships given out to students all across the country, and there were a total of 2,288 competitive applications. The award amounts our students won range from $1,500 to $3,000. This is the best performance in program history. I'm also proud to report that we successfully went through a Council on Accreditation site visit in October 2019 with no areas of non-compliance and no citations whatsoever. On June 30th, 2020, we were notified that we received a 10-year accreditation from the Council, which is the 3rd consecutive maximum accreditation without a single citation. I can now proudly say 30 years and no citations. I think it's one of the top performance aspects of my career. There are also some exciting developments in the nurse anesthesia curriculum to share. As you're fully aware, ultrasound is increasingly becoming an important tool for nurse anesthesia professionals because of its ability to provide more accurate diagnosis, improve patient outcomes and safety, and reduce costs. Proficiency in ultrasound techniques is a desirable skill for our students to have as they enter the workforce and for our alumni to pursue through continuing ed. We've already begun providing ultrasound education as part of our current nurse anesthesia curriculum, but my vision is that our program will become a center of ultrasound excellence for both student education and CRNA CE training, with a focus on ultrasound-guided blocks, line placements, and point-of-care examination, or POCUS. I have petitioned the university and have purchased 2 cutting-edge GE20 venue systems, as well as some task trainers. However, we need additional resources to emerge as a leader in ultrasound education for nurse anesthetists. For this reason, I'm asking you to make a gift to the Nurse Anesthesia Ultrasound Resource Fund during the 2021 Pitt Day of Giving on February 23rd. This fund will help support student projects and the purchase of additional ultrasound resources for the program. Your contribution will not only make a difference to the efforts of the nurse anesthesia program, but also count toward the donation totals for our school of nursing as we try to climb to the top of the Pitt Day of Giving School and College Participation Leaderboard. That will win us additional challenge funds that we can use within the school. As a preview of some of the incredible ultrasound work already being produced at Pitt School of Nursing, I invite you to stay tuned as Dr. Daryl DeLima, a current nurse anesthesia student and a captain in the U.S. Army Nurse Corps Reserve, presents his DNP Scholarly Project, a continuing education course entitled Concepts in Ultrasound Skills and Procedures for Advanced Practice Nurses. I want to finish by saying thanks. Our program reputation is largely due to you and the excellent care you provide around the United States. We are exceedingly grateful for the support you provide, not only through donations, but also as champions of our program, as a resource for our students, and as advocates for the profession. I hope that we'll be seeing each other soon, face to face, but in the meantime, please enjoy the following presentation by Dr. DeLima, and as always, hail to Pitt.
Hello everyone. I am Captain Daryl DeLima, and I am a prior service active duty Army Nurse Corps and Operation Enduring Freedom veteran. I am a senior and am currently the class president for the Nurse Anesthesia program's class of 2020. After graduation, I will be working in Pittsburgh and will continue my service in the Army Reserve. Doctoral education is distinguished by the completion of a scholarly work that demonstrates synthesis and application of the student's acquired knowledge and lays the groundwork for future scholarship. In the DNP program, this scholarly work is the DNP project. I presented my DNP project in August 2020. It was titled The Development and Implementation of an Ultrasound Training Program to Improve Basic Ultrasound Knowledge and Technical Skills of Anesthesia Providers, now known as Concepts in Ultrasound Skills and Procedures for Advanced Practice Nurses. The purpose of my project is to address the need for a standardized curriculum for anesthesia providers to enhance their understanding of ultrasound physics and proper use of ultrasound machines, to include machine knobs and different types of ultrasound probes. Current council and accreditation standards require ultrasound content within nurse anesthesia program curricula. However, this is a recent requirement, and of the more than 50,000 CRNAs, it is likely that the majority have not attended a program of formalized instruction. The utilization of ultrasound technology as an adjunct in the clinical setting is becoming the gold standard of care for multiple procedures. Ultrasound machines are portable and allow practitioners to view a patient's anatomy non-invasively. Ultrasound technology and guidance can be utilized in a number of ways to aid anesthesia providers with airway assessments, obtaining vascular access, transesophageal echocardiograms or TEEs, and for regional anesthesia administration. With the help of my nurse anesthesia faculty advisors, I was able to collaborate with the state-of-the-art Winter Institute for Simulation Education and Research, known as WISER, to design and create a formalized ultrasound curriculum that follows a mastery learning model. The didactic portion of my project is online and ready for testing. The hands-on portion of my project would require participants to utilize the GE Venue 50 ultrasound machine to complete a series of tasks on trainers and live models to demonstrate proficiency with an ultrasound. The knowledge and skills participants will acquire from my project will serve as the foundation for ultrasound training as they continue their training to become proficient in other skills that require ultrasound guidance. The utilization of ultrasound technology will continue to increase in the clinical setting. With its increasing use, it is safe to say that all anesthesia providers can benefit from a formal block of instruction to reinforce concepts and to ensure that proper technique is being used to maximize their delivery of care. This ultrasound training course has the potential to effectively improve the knowledge and the technical ability of novice and experienced anesthesia providers. I hope you enjoyed this overview of my DNP Scholarly Project. Please give generously to the Nurse Anesthesia Ultrasound Resource Fund during the Pitt Day of Giving. Thank you, and hail to Pitt.